it's a rare problem to begin with and it's being divided up amongst a bunch of different people, no one really becomes great or as good as they potentially could be if they saw a lot. Yeah, when I came to Charlotte, the congenital hand care was just fragmented. It was whoever they went to see would kind of take care of them, and we recognized the need for a comprehensive team-based approach. And so when I came to Charlotte, Dr. Wattenbarger was one of the pediatric orthopedists. He's now down at the Shrine in Greenville, but I went to him and Lois Osier and said, we should start a dedicated clinic for congenital hand. And at the time, to my knowledge, it was the first congenital hand clinic in the Southeast that specialized just in congenital hand. It's been amazing to see what that clinic's able to take care of now and the complexity of things. And patients fly in from all over the world. There's a patient coming from China for surgery just in the next few weeks.
Congenital hand differences include a wide variety of conditions. They occur in approximately 1 in 1,000 babies and can involve any changes to the normal development and growth of the upper extremity or hand as the baby is in the womb or beforehand.
Congenital hand problems probably fit into the rare diseases category, so it doesn't occur commonly except for a few simple polydactylies when you're born with an extra digit. So complex problems require a lot of attention, right? They require a lot of expertise, and they require a lot of time because when parents have a kid who's not normal, they had expectations of a normal child, and now they're born with a child who has some differences. It takes some time to work your way through decision making and help them understand what you can and can't do to make the life better of their child.
The Congenital Hand Clinic is something that we are really proud of here, and something that I think provides a really important service to our local community and our region at large, because we really are able to see and advise and treat the babies and the kids and their parents for the entire spectrum of congenital differences that kids can be born with, from fingers fused together at birth, which is called syndactyly, to extra fingers, to missing fingers, and there's really not a congenital hand problem or difference that we can't address here with our large team of physicians. The team approach has been really helpful to make sure that we're covering all of our bases and getting multiple opinions at the same office visit for the patient and their parents. The kids and the parents also benefit from the fact that there are a lot of other parents and kids in the office at the same time, and they can see them and see that they've got similar problems, and that builds a little bit of a community and a support system for them.
Probably the most important thing we do is give people hope, right? That normal brain, normal rest of the arm, healthy kid, that things are going to be fine, and then we work towards what we can do to make it better.
Actually, our very first patient on our first congenital clinic day, I know his name, I know his parents. He was a little baby at the time, and he was born without thumbs on either side and without a radius on either side. He had a few other problems with hearing and vision and other things. Ultimately, we got to know the family very well, and when the baby got a little older, we did surgery to straighten his wrists out, and we made thumbs on both sides. We made a thumb from the index finger, so he's now got a thumb and then 3 fingers, which we do a lot. That's a common surgery that we do, but the reason it stands out is about 3 years ago, I was at a monster truck rally with my son in Charlotte, and we were in line for the bathroom, and I look in front of me, and wouldn't you know it, there's that kid with his mother, and he was 9 years old. And saw the mom, and I tapped her on the shoulder, and she immediately recognized me, and she touched her son and said, "This is the doctor that made your thumb." And it just brought tears to my eyes. And then my son, who was with me, was 6, took that hand and held his hand and walked away. I know.